Hello, my name is William Hall. I'm the owner and massage therapist at Goodwill Massage Therapy. And today we are going to discuss some of the modalities that I do. I'd like to demonstrate them for you and maybe give you a little more information than you had before on what each modality is good for, how I use it, and how I integrate it into a tailored session of body work. The first one that I would like to demonstrate for you is called craniosacral therapy. Craniosacral therapy was developed by an osteopath named Dr. John Upledger. It focuses primarily on balancing the flow of cerebral spinal fluid through the body. Cerebral spinal fluid is the fluid that cushions the brain as well as the entire nervous system. It's a very, very light modality. I'm only going to use a touch about the weight of a nickel, so about 5 grams, and I'm going to go around the body and tune into the flow of cerebral spinal fluid and look for imbalances. So there are a couple super awesome things about this particular modality. One is it can be done over the clothes. So if you are nervous about getting undressed, this is a great modality for you because you don't have to. This is really good for treating migraines, for working on people that have severe touch issues, whether they have fibromyalgia and can't handle a lot of pressure, or are babies, or old, or any of those things. So what I'm doing right now is I've cradled Amanda's occiput just on the base of her skull, and I am going to tune in. And there's not like a lot to see here, but hopefully what you will be able to see is changes in Amanda's breath, which will indicate to me that she is getting something out of the treatment. So now I'm applying gentle pressure to the back of her skull, and I'm just gonna wait for a little bit. And what I'm feeling is a gentle relaxing in her neck. Now we have a pause in the breath and an inhale, deep inhale and exhale, which indicates that she's had a change in her body. There's another one, which lets me know that I've achieved some sort of balance. Now that hold can be held for a long time, and we'll continue to get change out of Amanda. But what I'm going to do is just go ahead and move on, hopefully just somewhere where you can see it a little better. So this is another, what they call in craniosacral, a listening station. So by putting my hands gently over Amanda's knees, just on top, I start to tune into the flow of her cerebral spinal fluid. And I wait for just a second. And as she enters into the second phase, I'm going to apply gentle pressure onto her knees, moving them inward, right? And again, it's super light. You won't even see my hands move. But again, we're going to wait for a change in Amanda. And like I said, because this modality is so light and can be done over the clothes, there's no contraindications or restrictions on who it can be done on. So anybody from people that suffer from anxiety to people with burn scars, you can work on all of those demographics and anything in between, and they will get some benefit, some effect from it. I almost always incorporate this style into my tailored bodywork sessions because it's so relaxing. I usually open with a craniosacral hold on the feet, and I usually close with one on the feet, which I'm going to demonstrate just a minute. Now we're going to go and we're going to wait for that second change in breathing pattern. And there it is. And so I'm not sure if the camera can catch that, but what you would have seen, if it could, is that Amanda's breath moved from deep inside of her stomach and was a more full breath up into the chest. So again, I'm going to close her off with the craniosacral. It's just down at the end of the feet, and I'm going to gently rotate her feet in when the flow of cerebral spinal fluid is on its emptying phase. Okay. As you can see, Amanda's very relaxed already. Okay. So that's a brief demonstration of craniosacral therapy. Again, this modality can be done on all sorts of clients and treats a variety of ailments. The next technique I'm going to demonstrate to you is called Reiki. Reiki is a laying on of hands energetic healing modality brought to us by Yusui Ryoho from Japan. This modality can either be done with laying hands on the body or just off the body. So Reiki uses symbols, which I will draw with my hand into the field to affect change in the body. Again, this technique can be done with clothes on or off. For people that are sensitive and don't want to get undressed, this is another great modality. It's also very relaxing, and since we're treating dis-ease at the level of causality, you can do it for anything from emotional trauma to physical trauma. So when I'm giving a Reiki treatment, I personally usually do hands-on because I'm a massage therapist, but again, it's not necessary. And if something's happening that I'm sensing farther out from the body, then I will place Reiki in the field, into the person's field. Generally, in a full Reiki body session, you'll have specific places that I will use my hands, and I'm going to demonstrate that for just a minute for you so that you can see how gentle and non-invasive this very potent treatment can be. Most of the hand positions are directed at moving Reiki in through the chakra system, which are centers of energy processing in and on the body. So in my hands, I can feel change in kind of density in the field around her body. What you will be able to see is a change in her breath. And a change in her breath, again, will indicate that change is taking place in her body. I almost always combine Reiki into my bodywork sessions. I'm a firm believer that intent can change the outcome. And Reiki focuses a lot on using intent to create healing. So there we have a change in breath in Amanda, which means she's experiencing change in her bodies. There are 3 different levels of Reiki, which I teach all 3. In Reiki level 1, you learn the first power symbol. That enables you to work with the Reiki frequency by passing the Reiki frequency to a recipient, as well as being able to palpate or to feel it. Ooh, that's fun. In the second level of Reiki, you learn to work on even the finer forms with 2 new symbols. The third Reiki attunement, you actually learn the ability to pass the attunement on to others, so you'll be able to teach Reiki as well. Okay. The next modality that I'd like to demonstrate is called neuromuscular therapy. Neuromuscular therapy was developed by Dr. Janet Travell, and it treats mainly musculoskeletal disorders and pain. The process is simple. I'm going to spread a little oil before I get going. The process is simple. I'll use this when treating specific injury sites. If you've got muscle contusion or adhesions or trigger points is specifically what we're going to treat, which is a point of hyperirritability inside a taut muscle strand. So the way this technique works is I will find a large adhesion, say right here in Amanda's shoulder, and what I'm going to do is I'm going to work the affected muscle, which in this case feels like the rhomboid major. I'm going to first start at the origin of the muscle, which is right here on the spine, and it inserts over here into the vertebral border of the scapula. And so I'm going to apply firm but gentle pressure, and I'm going to work the muscle from origin to insertion. I'm going to do that a few times. What I really want to be sure of before I go in there after this trigger point is that I got nice blood flow. So you can see that around my thumb it's getting pink. Right under my thumb it is white, which means that there's no blood under my thumb, and there's blood being pushed through the muscle in front of my thumb. Now, if you watch closely, when I lift my thumb, it's white, and then blood rushes in and turns it pink. Now, I know that I've got a lot of nice blood flow. So now that I've worked it origin to insertion, I'm going to hold the insertion point and the origin point. I'm going to wait for a minute till I feel the whole muscle start to relax. Now, since the rhomboid is underneath the trap, I'm going to have to use my elbow to get the trigger point out. Otherwise, I might fatigue my thumb. So I felt a softening in her tissue. And now I'm going to find the trigger point again with my thumb. And the way I know it's a trigger point is when I push on it. If I ask Amanda if there is a, what we call in the business, autonomic phenomenon, that's if there's a feeling somewhere else in the body. Either the pain can go up or the sensation can go up her back into her neck. It can come out over the shoulder. It might come in underneath the scapula or go down the back. Now I'm right on it right here, and so I'm going to mark my place. I'm going to watch where it turns pink, and I'm going to get my elbow in there. And then one of the differences between me and other therapists is I don't just dive in and push as hard as I can. I allow the tissue underneath me to tell me how hard to push. If I push too hard, it will push back on me. And if I push too light, I won't get any change. So I just push hard enough that I start to sense change in the tissue, which is happening now. And as the tissue relaxes, I go deeper. Let's see Amanda's breath starting to change again. And now I'm getting a release. Excellent. And so now I've just felt the muscle completely relax. The adhesion is gone. After I am done, I'm going to get a stretch out of the muscle, because the stretch tells the Golgi apparatus in the cell that this is the new resting length. Again, I'm going to hold origin and insertion just to make sure I completed my work. Another nice change in breath. I'm going to get a stretch out of the rhomboid by pulling gently down on her shoulder. And excellent. The next modality that I'm going to talk about is called deep tissue structural integration. And what that means is I apply deep tissue to the affected area of the body in order to promote better postural alignment. So structural integration refers to how the muscles stack up and support weight. And then the deep tissue is for releasing any part of the structure that might be pulling it out of balance. So deep tissue is done on a specific area. I'm not just going to deep tissue the entire body. It would take too long and be too painful. But Amanda here has a nice set of scoliosis, and so she's got a lot of imbalance to work on. So structural integration would actually be perfect for Amanda. And just to give you an idea of what a deep tissue stroke looks like and feels like, I'm going to again apply some oil, some nice effleurage strokes. And when I go into the deep tissue, and again, just as the name implies, deep tissue is any stroke that is meant to affect the deeper layers of muscle. Now, when I do deep tissue, I always wait for a response from the tissue before I go any deeper. This prevents me from causing extra injury to the area, cuts down on recovery time because sometimes deep tissue can make you sore the next day. It also builds trust between client and therapist. I can get much deeper with trust than I can with pressure. If I push too hard and I hurt Amanda, then the next time I go to work on her, she's going to be more afraid of my touch. Her tissue will push back, and I won't be able to get in deep to do the corrective work that she needs. So I'm not actually pushing any harder, but if you will watch, I'm lifting my arm, and this is making my elbow quite a bit sharper because I found a place in Amanda that really needs to be released. Releasing it on the side of her spine that is raised higher than the other side is going to create more balance in her structure, and that's where we're getting the structural integration. So you can see that Amanda's breathing pretty hard right now. And she's breathing hard because she needs to get fresh oxygen in the bloodstream to this area so that it can release. A great tip for receiving deep tissue is using your breath to create space in your body for relaxation. You focus your awareness with your breath into the area that needs to be released. And this has all sorts of psychological and physiological benefits. Now you can see I've got a nice bend in my arm. So I'm working pretty deep. I'm not pushing hard, but I can guarantee that she is feeling it in the deeper layers of her muscle. So I'm working my way right across the border of the spine. I'm going to slowly back out. And you can see how nice and pink the tissue is getting. I'm going to do one more stroke up the same side. Now, if we were doing a full structural integration session, I would definitely include the hips and the neck because those are big places where imbalance can start. When choosing your massage therapist, you really want to work with somebody that has the kind of combination of modalities and styles that you need to meet your goals. If you're just going in for a general relaxation massage and you don't have any specific issues you need to work with, then anybody that knows Swedish massage will probably be fine. If you have specific areas of your body that need body work, or specific reasons that you need body work, then you need to make sure that you are getting a therapist who has the tools that can help you. I kind of just automatically moved up to Amanda's shoulder, and now I'm doing deep tissue stroke on her upper trap. So I am again following the muscle path all the way to the insertion point right here on top of her scapula. I just got a nice jump, and now that I'm on top, right here in the notch, I'm going to kind of push in and down to get a release out of the levator scapula that comes right up the back of the neck. And again, this is going to create more balance in her spine and in her head because we really want her head to get back above her shoulders. Okay. The next modality I'm going to talk to you about is acupressure. Acupressure uses the same system as the acupuncture system. It operates on what they call a meridian line, which is a line of flow of what they refer to as chi or life force through the body. And at different points, you can access the flow of the qi to accentuate or help its movement through the body. I use acupressure in almost every session simply because it is the most effective and easily integrated technique that I have found. So there are acupressure points all over the body, and they do a variety of things. You can treat pain, nausea, headaches. You can treat emotional discomfort as well as physical discomfort. Anything from like frozen shoulder to grief can be treated with acupressure. A lot of the neuromuscular points that come up are also acupressure points. So what I'm going to do right now is I'm going to find a few on Amanda to treat her physical body. So some common ones I use are at the base of the spine and the base of the skull. There are 3 points here that I am touching, 2 on the bladder line and 1 on the governing vessel. These particular points are really good at relaxing the client, and I can also kind of tune in at these points and get a feel for how energy is flowing through her spine and around her body. Again, we're going to watch Amanda's breath for a deep cleansing breath to let us know that she is experiencing change from the treatment. And through this particular technique, I can assess a lot of imbalances, a lot of different types of imbalance, and treat them as well. I'm going to walk up her spine, hitting the bladder points and governing vessel points on the way up. I'm also kind of feeling how Amanda's spine takes little twists and turns because of her scoliosis. And I'm going to get right up underneath the base of her skull. Again, working 2 bladder points on either side of the spine, and then the governing vessel right on top of the spine. This particular hold is really good for relaxing your client. So I may use acupressure to treat trigger points, in that holding the 2 points along the muscle may also be acupressure points. It's just a very effective way to get energy moving through the body as well as blood and qi. And so what I'm going to do now is I'm going to come over here, and there is a small intestine point right on top of the scapula here, right in the middle of the scapula here. And so I'm just going to hold these 2 points until I feel an energetic transfer between them. And what you may or may not be able to see on the camera is that Amanda's shoulder will likely fall a little bit farther from her ear. Each hold takes about 90 seconds. Try to move my fingers out of the way so you can see it. Using my middle finger, which is a neutral finger, and my thumb, which is another neutral finger. Here's the change in breath, and I'm getting a little bit of spasming down here in the teres muscle, right down here, which just tells me that there's a little bit of blockage that needs to clear out of the way before her shoulder fully drops. Again, acupressure can be done over the clothes or right on the body like I'm doing now. And since it treats such a wide variety of ailments, it's good for anybody that can stand light touch. I even treat hangovers with acupressure. There was a nice even cleansing breath from Amanda. And I'm not sure if you could see it, but her shoulder is much more relaxed. We have very pink, so it's got a lot of nice blood flow. Well, thank you so much for joining me. I hope this was informative and helpful to you. If you want to know any more about my style or how I integrate my body work, please go visit www.goodwillmassage.com. I hope you have a lovely day.